While every other administration is racing to contain the spread of coronavirus, the number of cases and centers for treating, isolating and testing people is being increased. Karnataka government has now announced an entire building and dedicated it to treating COVID-19 patients, and this has drawn strong protests from the people in the localities. Take a look.
The number of coronavirus or the COVID-19 positive cases are increasing by the day in Karnataka. Every day we hear at least 2 more COVID-19 infected cases being reported. The Karnataka government is racing against time to contain the spread. Several government hospitals are being equipped with infrastructure required to handle the influx of suspected and infected COVID-19 patients. The state government announced that an unused building meant for a cardiac specialty hospital in Shivajinagar will be turned into COVID-19 specialty hospital. There's a COVID-19 specialty hospital coming up right here in Bengaluru city's Shivajinagar. It was announced by the government of Karnataka just a few days ago, and we are right here inside the building which will be transformed into a COVID-19 specialty hospital exclusively to treat the infected people. Right there is the entrance to this hospital. We can see right outside the entrance, the roads are quite narrow, the buildings are put together in a congested manner without any space in between. So this particular plan by the government of Karnataka has the residents over here up in arms against the decision, saying that a highly infectious disease hospital coming up in the middle of a congested area will jeopardize the health of the residents here. Moreover, this hospital will be a 100-bed specialty hospital for the COVID-19 patients exclusively. Earlier, according to the blueprint of this particular building hanging right here, it was proposed to be a heart hospital at Broadway Road, BBMP Ward number 63, that is Jehemahal. It was inaugurated 18 months ago when Roshan Beg was the MLA of Shivajinagar Assembly constituency. This particular plan includes a basement floor plan for parking space, a ground floor, the first, second, third floor along with a terrace being included in the same. This particular building will be a 100-bed specialty hospital for COVID-19 patients, but that is still in the talks and works have started over here. Infosys Foundation is in the work of trying to fund for all of the equipment required, but it needs to be seen whether a COVID-19 hospital will exactly come up over here or not, given the situation, the location of this particular building being in middle of a very crowded place for an infectious disease. COVID-19 specialty hospital in midst of a crowded Shivajinagar. Residents worried over location of the hospital. So let's go ahead and speak to some of the residents over here on what their apprehensions are. Sir, first of all, did you know of this particular announcement by the state government?
No, madam. No. Nothing has been given. No announcement has been made. From yesterday, there was an advertisement in the Deccan Herald that these patients are being shifted to this hospital. All this area residents are in panic. All this is densely populated area. There are small children, old age people, and other people. All are working here, and everybody will be here. They say that even if you cough or sneeze, the virus is going to affect the people. BBMP has also not taken any initiatives. They have not spread any medicines here. So people are very much afraid. They doesn't want any patient to be shifted here. So we are protesting here, not to shift the patient here. Let them take it to some isolation place out of the city. They make some beds and keep them there, not in the city, because it is a hugely densely populated area.
Sir, what kind of business do you own over here, and is your house also located in this area?
My house. There's the front of the hospital, my house. Also, they have the restaurant here. So how coming to people? So nobody's come to a meeting here in the hotel. They have so many restaurants here in the street. There's commercial on the behind also residency areas. Also, school also is very close to school. The 200 meters to 2 schools there. So back 200 meters to 2 schools there.
Their concerns are not completely unfounded. The place is a congested one and a slum is also located nearby. The slum poses a challenge in terms of COVID-19 awareness amongst its residents. After much persuasion by News 9 and the residents, Shivajinagar MLA Rizwan Arshad agreed to listen to the grievances of the people protesting in his constituency. I will convince the government against it or get convinced of their plans.
See, I have not been consulted before being announced that this hospital would be reserved for COVID-19. I would like to talk to the minister and try and understand, in a thickly populated area, if this kind of a hospital is established, will it not affect the general population? In case it doesn't affect the general population, we all have to take responsibility to contain that disease. In case it affects, then we would not like to have this here.
With a response from the MLA shirking off accountability and responsibility, the people seem to have been left to fend for themselves with regards to their objection. Rizwan Arshad has promised to bring the objections of the people to the notice of the Health Minister Sri Ramulu and Medical Education Minister Dr. K. Sudhakar. It needs to be seen now what decision the government finally takes. Meanwhile, preparations are underway at Victoria Hospital to build a ward for COVID-19 patients. The state government has ramped up its preparation to fight COVID-19 right here at Victoria Hospital's BMCRI. A new special ward to contain the infected patients is currently coming up. It's also for isolation of the suspected patients as well. And right here we have the novel coronavirus 2019 infectious diseases screening center, where people who are being referred to over here are being screened. Any suspects with any sort of a little bit of symptoms are being screened at this place right here by the authorities. And right on the other side of the building, we also have the testing center for COVID-19, where all of the blood samples of the suspected patients and suspected people coming in from different countries and the contact of those people are being tested right here. And this is in preparation for the future, whenever the state government does need to tackle with the growing number of suspected cases. This is the place where which will help the most. This is the ICMR referred place for testing of all of the blood samples for coronavirus. And so far we know that the number of tests being done per day in India is quite less. So this is also in preparation to increase the number of places which can test all of the blood samples, and the results can be availed in a short period of time so as to eliminate the spread of COVID-19. So this is one such place where around a 50 to 70 bed specialty hospital for coronavirus will be coming up just in a few days' time. And we have seen already at several places the preparations being ramped up to battle COVID-19. With camera person Sushil, this is Amrita for News 9, Bengaluru.